for joining us for more on this, especially as the vaccination rollout takes hold across Nigeria, is Nsa Basia Kanem. Is a pharmacist and public health practitioner. He joins us virtually. Thank you for joining us on the program. We know you held up a little bit somewhere in Lagos, but glad to have you join us. Tell us, does Nigeria have a central base for immunizations, like a database?
Well, the National Primary Healthcare Development Agency has a database that takes record of immunizations that are done in Nigeria. Unfortunately, the current immunizations that we have right now is not being captured by, it doesn't reflect other immunizations that have been carried out in the past for each individual. And I think that's what needs to be done right now, such that at the point of receiving immunizations, individuals, healthcare workers can have a good idea of all the vaccines that a particular person has taken before, since we do not have a national database that shows these immunizations in the past.
So in terms of administration of vaccines and COVID-19 as is ongoing, tell us, is there a sort of software platform for such?
Well, yes, there is a platform currently. In fact, that platform has been launched for both vaccines. And currently the platform for Moderna vaccine is available. And this platform basically is to document and serve as a reservoir for information on people who have taken the Moderna vaccine. And this is supposed to be like an information database, such that in the future, persons can be identified. Persons who have taken the Moderna vaccines can be easily identified. But what we desire is that the database or this software should not only contain Moderna vaccinations, but should also contain the database for all other vaccines that a particular individual has taken in the past. Let's say, for example, somebody who has taken yellow fever vaccine in the past, or maybe hepatitis vaccine. This vaccine history should be captured in the software, so that healthcare workers can have an idea of the vaccine that have been taken by each individual, and that can also be used in the national database for immunizations in Nigeria. So that the software exists, but we are looking for a way we can make the software more robust and contain more information about people taking the Moderna vaccine.
So essentially, better surveillance system and database as part of the vaccination program. But what's your take on the registration process that's ongoing, and this is before vaccinating? Some people have complained of not accessing the portal or being shut out, and this is online when they've put in their preferred centers. And we've also heard some who say that there are new centers since Moderna came in, and they've been a little bit unorganized. Instead of starting, they said they'll start at 9 a.m., and you have them starting inoculation at about 1 p.m.
Yes, you are absolutely right. I've also received some reports too, and unfortunately, this it doesn't speak well of our organization of this vaccine rollout. And so I think it's a call out to the relevant agencies and the healthcare workers directly in charge of immunization planning and implementation to strengthen the system so that we can deliver these immunization services in a more efficient way. Healthcare workers must report on time, and of course they should ensure that it is on a first-come, first-served basis that people are served. So we shouldn't see cases of racketeering, so that people who are willing to come out can be served adequately, because we know that there's already vaccine hesitancy. So the last thing we need right now is for people to come in and experience delays and all of that. So we are calling on all the people involved, agencies and healthcare workers, so please put in their best to ensure that Nigerians receive immunization, COVID-19 vaccination in a very conducive environment and with all amount of, effectiveness.
All right, we appreciate your time. Thank you so much for joining us. And Sebase Kanem, pharmacist, public health practitioner. We wish you safety, of course, in your onward journey. Thanks again.
Thank you for having me.